Hi all. I hope everyone is having a good time. I'm Arpita Saxena and I'm back with one of my research papers. This one is on dental anxiety. The title of the paper is Soothing Anxious Minds of Dental Patients by Relaxing Their Olfactory Auditory Senses, an Adjunctive Clinical Trial. I'll ask you to imagine yourself in a scenario where you have a dental visit tomorrow that isn't just a routine clinic. Please take a moment to tell me in the comments section how anxious you are for that appointment. Dental anxiety is at an all-time high despite numerous achievements in the industry. Some dental checkups are skipped due to anxiety or a fear of the unknown, which inevitably leads to poor oral hygiene. Development of dental anxiety and phobia is usually associated with the traumatic experience about dental treatment. Numerous studies provide credence to the idea that fear of or sensitivity to pain is a significant barrier to obtaining dental care. According to many studies, dental injection is considered as the most frightful question followed by the dental drill. But it is not only about the children, even adults also need to be taken care of. Numerous research conducted since the 1960s have proven the effectiveness of several pain management approaches like maintaining the room temperature at the appropriate level, a decent combination of soft and alluring colors that may please the patients while in the waiting room, providing excellent background music or calming their tense mind with the aid of some relaxing scents. There has also been some positive outcomes of visual therapy in dental offices. So, the aim of this study is to test the hypothesis, the effect of non-invasive methods like music therapy and aromatherapy on the anxious minds of dental patients and comparing the efficacy of the two respectively. The study design is adjunctive clinical trial. It is a type of study where patients receive one or more intervention or treatment. It was conducted in two private dental clinics. Anxiety level was assessed by using modified dental anxiety scale questionnaire. This questionnaire consisting of 5 questions and summed together to produce a total score ranging from 5 to 25. It was provided to the participants before and after the dental treatment. To give a base to the appropriate response of this survey, vital signs like blood pressure, pulse rate, and respiratory rate were additionally checked by using blood pressure monitor and stethoscope. During the dental treatment, soothing music with an alternative of headphones and the fragrance of lavender aroma with the help of an aroma electric diffuser was given to every patient. Sampling size was convenience. Patients who provided written consent and were between the ages of 11 and 65 were required for inclusion. The study did not include people who did not provide written consent and had systemic diseases or had never received a dental care before. In a private dental clinic in Jaipur, a pilot study was carried out to determine the viability of the groups and to determine the sample size for the main study. The main study was conducted in two private dental clinics of Jaipur with sample size of 123. Except on Sundays, the main study was carried out in the evening time by the principal investigator, that was me. Independent variables like age, gender was tried to retain in 50-50 for the proper analysis, and for this, MATLAB software was used. A statistical analysis has shown that aromatherapy is more effective. Patients' anxiety scores were lower following their individual dental treatments with a confidence level of 93.8%, and they will choose an aromatic environment once more if they have future dental appointments. Music has some favorable effects in the music intervention. I'll explain some of the values that I have highlighted with yellow. A change of 2.917 in the mean anxiety score of females was found and was declared significant with a p-value of 0.014. When compared to the baseline data, there was a decrease in the male anxiety score with a mean score difference of 1.765. Overall effect of aroma on patients' anxiety levels were as follows, with a confidence level of 97.9% and 99.9% and p-values of 0.021 and 0.001 for diastolic blood pressure and respiratory rate respectively. Aroma helped reduce blood pressure and respiratory rate. See paper for other between groups comparisons. I have put the link at the end of the video. This study had an approach towards diminishing anxiety level of patients, including adults as well as children, by means of giving them non-invasive interventions like music and aromatherapy amid their respective treatment. It relied on controlling brain waves that can trigger positive results and help reduce anxiety. The pattern of these cerebrum waves varies in alpha waves, beta waves, and delta waves. Speaking of music, many studies show that music with a frequency of about 60 beats per minute can cause the brain to synchronize with the rhythm that produces alpha brain waves. Strong rhythm stimulate brain waves, while slower rhythm create a calm and meditative state. Speaking of aroma, it is believed that the scents of essential oils have a strong effect on the emotional state of people. It originated in Chinese and Egyptian cultures when a French pharmacist coined the term aromatherapy in the 1920s and experimented with wound healing essential oils during the First World War. Fragrance of lavender oil has been shown to lower scores and increase theta 1 and alpha brainwave and decrease beta 1, which is associated with relaxation. Another interesting finding in the study was the apathy of people to music, or in other words, it is called musical anhedonia. About 24% of the participants in this study were not interested at all in listening to music, where people do not experience any material positive emotional response from listening to it. This may be one of the reasons why aromatherapy has proven better than music therapy in some groups. Future studies may include more interventions such as vision therapy or a combination of groups with a larger sample size to obtain an overall effect. Other variables such as socioeconomic status can be considered to obtain more accurate results, as patients with lower SES might come for the dental treatment with a preset mind for pain. These are the references I used in this video and a link to the paper. This is a link to my portfolio where under the UX research tab, you will find links to all my research and other UX UI design work. Please contact me through my portfolio or LinkedIn if you like the video or have any suggestions. I'll be happy to address them in my future videos. Lastly, I would like to say thanks to all my colleagues who helped me to conclude the study. Thank you.